like to find new ways of getting healthy. Joining us today is cardiology Dr. Benjamin Call from Portneuf Medical Center. Thank you so much for joining us today.
Thank you for the opportunity to be here.
Today we're going to talk about something that is easy to do, it's free, and we need to be doing a lot of it. Tell us about some of the benefits of walking.
Walking. You know, we've always known that walking was good. I believe God gave us two legs for a good reason. But the more we get into this science of this, the more we're discovering that walking has benefits that are to our health that go far beyond just feeling better in the morning when you get out of bed. We're now discovering that walking, if you're walking enough, it will lengthen your life. It will reduce your chance of being in the hospital. It reduces your chance of having serious illness, and it makes a huge difference. It's as important as many powerful medicines that we use. Walking actually is more powerful.
Okay, and so how much walking should we be doing? I mean, you know, at different stages of our mobility, we should have different goals, I guess you'd say, but on average.
There have been two big studies that have come out in the fairly recent past. One shows that if you can get in 150 minutes a week, that's 30 minutes, 5 days a week of walking, that is really make a huge difference. If you can go another 30 minutes to an hour, that adds another 10%. But if you can at least get in 30 minutes, 5 days a week. Another study showed that for some people like to count steps, and which is fine. Yeah. And basically, the more the better. But it tops out. The benefit tops out at around 8,000 steps, which for most people is around 4 miles a day.
Okay.
So, but yes, walk.
And so when we do walk, when we, obviously if we want to get into a walking program, there's lots of agencies and lots of people that can help us out and maybe devise a plan. But we live in a great area, and when the weather's nice, there's really not an excuse to go walking because we've got some great areas.
Yeah. We got the wellness center, you got the cemetery, you got fabulous places to go walking. A lot of people say, well, gee, I'll walk during the weather, and when the weather's good, but when the wind's good, when the weather's bad, I don't. And I invite my patients I say to them, I would like to invite you to go for a walk. 30 minutes a day, 5 days a week. And I would like to invite you to find a way of doing that even when the weather's bad. Now that could mean walking in the store, that could mean walking on a treadmill, it could mean walking around your kitchen table.
Indoors.
But find a way of doing this year-round, make this a year-long habit.
Right. Now we want to be safe when we're walking. What advice do you have for your patients on that?
If you feel unstable with walking, then use a cane.
Okay. Because
frankly, if you're using a cane or you're using a walker, you'll be more likely to actually walk than if you're afraid that you're going to tip over.
Oh, fantastic. Dr. Call, thank you so much for your advice. And of course, it's free and everybody can pretty much do it.
Yeah,
all right. Thank you, Dr. Call.